Good evening, everyone. I'm Adriana Davis, the regional manager, and I just wanted to recap first before we initiate this conference call meeting and kind of retouch on some of the things we talked about last meeting. So we really went heavy with the Iron Triangle, and just to recap on that, as you all know, that's cost, access, and quality, and they're the three major cornerstones of healthcare. So we kind of discussed how we would improve in these areas within our hospitals so that we can beat out our competition. And just to kind of recap on that, we want to kind of define what cost is. And it actually has three different meanings, being price, the healthcare expenditure or spending, and then also from the physician's perspective, which will be the things like staff salaries and capital and things of that nature. So just kind of touching on that cost a little bit more, speaking about the expenditures, there are 9 particular reasons that the expenditures are continuing to rise. That would include third-party payments, medical bills from our third-party payers, an imperfect market. That's when we're utilizing healthcare because it's driven by need instead of by want. You need healthcare, you don't want it. Then also the growth of technology. We're pretty innovative within our facilities, so that's something that's continuing to cost us, as well as the multi-payer system and defensive medicine, which is resulting in quite a number of legal cases. Luckily for us, we don't have that big issue in our facilities, as well as waste and abuse and practice variations. You guys are doing really good keeping the waste down, so good job on that. But we still do want to kind of discuss some of the things that our zones are having trouble with today. So if you guys could key in on some of those things as discussed in the last meeting and just kind of report and update me on what you've accomplished thus far.
Hi, Adriana. This is Laterica, and I'm reporting from Region 2. In our region, we have issues with cultural competency as it relates to the different races and ethnicities and the health disparities that they face. Some of our issues with our cultural competency is our staff's ability to relate to the different patrons that we have here in the hospital. Some of the issues that they have are especially the language barrier. We have a lot of Hispanic patients that come in and they have issues understanding the documents as it ties into whatever issues they're having. The African American community that lack the presence in our facility. One of the reasons can be due to the lack of insurance. They don't come in for the primary screenings, therefore their diseases have taken over their lives, such as diabetes and cancers. There's two of the highest rated ethnic groups in our area that have issues with that due to them not coming in and getting their primary screenings for those issues due to the lack of finances or insurance and things of that nature.
Good morning, Adriana. Just to give you a little insight on what's going on over here at Regional 1 on the mental health floor, we've had way more Baker Acts than I would actually like. As far as admissions, we've admitted about 30 patients, I believe, on this floor, and of those 30 patients, we have had 25 Baker Acts for the month of November. And I've done research simply because I couldn't understand why we had so many Baker Acts. The research shows that about 63% of African Americans believe that depression is a personal weakness. And the reason why I focus on African Americans is because we serve in the south side of Tallahassee. We're serving mostly African American patients, and that's really what our floor consists of most of the time. Probably about 90% black and 10% other races. I also found only 8.7 African Americans seek treatment as far as mental health services, opposed to 16% of whites. And I've also found that adults are 20% more likely to report serious psychological distress in a white community opposed to in the black community. And I think my strategy here over here at Regional 1 is to definitely get into the community to let them know that we support you. We're here. We want you to come if you need help. Let us know how we can help you. Mental health is not something to be afraid of. It's not something that is natural. It is seriously a disease, and it can get worse. So we're here, the services are here, and I'm working with my staff to do some community benefits, some community outreaches, maybe some programs around the south side of Tallahassee, just so that we can decrease the number of Baker Acts and increase the number of voluntary admissions.
Hi, Adriana. This is Lashara Key. I'm coming from the compliance department. I'm here to report on the new laws that are being passed for the north and southern states. Since these new laws that are being passed for Oregon, Washington, Montana, and Vermont, now that they're declaring they're going to be using euthanasia. With these new changes for the laws for the adult euthanasia, now we're trying to figure out how to better a way to prepare for child euthanasia. With cases such as little Dylan, we want to be able to find a way to better help the hospitals, will help our region's reputation, help our organization's reputation to be able to handle situations like that. Since Belgium and Netherlands have now adopted child euthanasia, we feel that it's going to be now be brought over to the United States, and we want to help to be able to prepare for a situation like that and conduct a plan. And so that's why I'm coming to you today, Adriana, to be able to figure out what's the best options and what we can do. Now we have to figure out how to best be able to help our patients to deal with these new changes. Since many people don't agree to it, 34% of Americans stated that if they were given the serious decision, they would consider it. And so, but this is different when it comes to our different races. Because whites consider, 65% of whites consider that if it came down to it, they would use any type of medical treatment to be able to end their suffering. Whereas African Americans, 60% of African Americans and 55% of Hispanics feel that they would like for their doctor to do anything they can to help them survive. And so we're trying to figure out the best practices to be able to adopt these new laws and to maintain our compliance and also patient satisfaction.
This is Brendan Lee reporting from the Division Specialist Department. I'm here to talk about AIDS and HIV, the rates, and what we've been noticing throughout our department. So for the HIV, it's a major topic in health disparities. The rates for HIV and AIDS have gone up throughout the years. To prevent the HIV virus in our area, we would like to come up with different programs to benefit young individuals, young men with these viruses and these cases.
Thank you everybody for meeting this week. We had a really good, productive meeting today, I would say, and I'm very proud of you all for all of the changes and improvements that you've made so far. Zone 2, I'll see you next week during my rounds, and you all keep up the good work.